And I'm very glad to welcome Paul Almond, who is currently on strike. So hopefully we'll all give him our full support on that. He's a member of Unison at We Are With You, which was formerly known as Addaction, and it's one of the UK's largest drug and alcohol treatment charities. It's based in Wigan. So over to you, Paul. We're very, very glad to have you, and tell us about your strike.
Thank you for inviting me. Hopefully everybody can hear me. So I'm a local Unison rep in Wigan, and for many years I was employed by the NHS as a drug and alcohol worker. And the problem we have really is it's an example of outsourcing. The Health and Social Care Act 2012 kind of put this in place so that large chunks of the health service could be sold off. And it's kind of done by stealth. So if you speak to the general public, you'll hear them say things like, well, you wouldn't dare sell the NHS off because there'd be such a furore about it. And I'm sure there would be if they kind of placed an advert in the newspaper saying NHS for sale. But they don't do that. They sell it off bit by bit. So our service, our NHS drug and alcohol service, was stupid over to this charity in 2013, and they promised to maintain standards, and they promised to maintain NHS pay and so on. And we were in the middle of a public sector pay freeze. A couple of years on, 2018, we came out of that. NHS negotiated this pay rise of 6.5% over 3 years, and our employer just said, we don't have to do this, so we're not going to do. So basically, we've not had the pay rise that the NHS had in 2018. So we've been on strike for a total of 26 days. And it's not just about pay, it's also about kind of maintaining a quality of service, because they recruit new staff paid even less than we're paid. What happens is they struggle to kind of recruit qualified and experienced staff. When they get new staff and they train them, they struggle to retain these staff. So basically, you know, they say to the councils who commission these services, you know, we can deliver this service, we can deliver the service the same standard as the NHS for less money. And the councils, because they're short of cash, they would happily take a provider who'll chop £3 million off the contract. So that's the problem with outsourcing. So we're on strike. We've had a number of days strike. We're having ACAS talks, and really we're determined that we're just going to fight on to get what they gave us a written promise for. It's a difficult job we do. We don't expect to be paid fantastic wages, just a decent wage for a difficult job. And thank you for inviting me.
Well, that was great, Paul, and that was within 3 minutes. So well done. You get and you're getting lots of clap. And I'd just like to read out a couple of comments about that from Karen. These strikers are unbelievably resilient, made promises when privatised which turned out to be untrue, and fighting for their rights. And from Alex, if there was ever a time that drugs and alcohol services were vital, it was when we are facing winter lockdown. Absolutely. Solidarity, Paul. We are with you, even if your employer isn't. And I'm sure that everybody else would completely agree with that.